Am I allowed to use your name?
Yeah.
All right, so I have Melissa here, and I was just telling Melissa I don't usually get to see my rhinoplasty patients 2 years out. I mean, just from the standpoint that most of them, I do them as young adults or teenagers and young adults, and they go elsewhere. They just kind of magically go to their places, and I'll see them many, many, many years later. So I had the opportunity. She showed up today. So hi, Melissa. Yeah. There we go. Hi.
I'm high-fiving you. Hello, everyone.
So a couple of things that I think is very interesting. So she's 2 years out. Okay. And tell us what you recall about everything at this point. I mean, you were, if I recall correctly, you were a little nervous on the morning of surgery, and
I was very nervous on the morning of surgery.
And then I saw you in recovery room. I'm remembering this, and then you were like, "Oh my God, I'm done." And then we talked. We saw each other. I mean, first off, about a week later. And then I think I saw you about roughly a couple months later, and then we've seen each other. It's been about over a year since I saw you last.
Yeah, I do remember coming in for my first post-op appointment. I remember laughing and being embarrassed to see you again because I requested that we take a selfie afterwards.
Yes,
because I didn't believe that the procedure happened. I was like, no, it's not done. I was like, he hasn't started yet, Mom. And she goes, no, it's over. It's over. I go, okay, make him take a picture with me. And so we took a group picture, and so that was like in my phone, and I was mortified coming back a week later. I was like, I can't believe I said that. But the procedure and everything was wonderful. I remember just being stunned that I had no black eyes. No, I could breathe the entire time post-op. And I remember thinking, like, what are the pain meds for? It doesn't hurt that bad. It was great. I wanted the procedure for 10 years, and so I got it at 25, I got it at 26. Nope. I got it at 25, and I'd wanted it since I was 15. And so it was kind of a long time coming for me. But ultimately, since my face head-on wasn't so obviously needing a rhinoplasty, and it was more of my side profile that needed it, I think that's what kind of took me a long time to come in. And so, yeah, I was very, very happy to kind of get the knot out. And
I'm going to you're a very interesting patient, okay? And the reason is you're very articulate about your feelings. I mean, I think there's a lot of patients that they say things, but maybe not to the level of how articulate you are with, I felt this. You're very like boom, 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 which is awesome. So I'm going to pick your brains a little bit, okay? So most of my patients, I'd say 99% of rhinoplasty patients, are patients that have been thinking about this for 5, 7, 8, 10 years, so on and so forth. We just saw a patient today who's been thinking about surgery for 25 years.
Oh, wow.
Okay?
Yeah.
So it's not an instantaneous, like, hey, I woke up, let's go get this done type of thing, okay? So I'm curious just from, I'm a technician. I'm like a mechanic. I just go do, chop, chop, cut, cut. So I'm now curious, like, how did that feel like? Like, here's something you've been kind of wanting for 10 years. You're processing it in your brain. You're, munching on it. You're chewing on it. You're whatever, researching, whatever, all these kinds of various things. And you finally get to see this thing. What does that feel like?
Oh, it was mind-blowing. I remember, when truly, too, when you're healing afterwards, I think it's not an instant, oh, I look great. It's kind of a, oh my gosh, what did I do? My face is, not there yet. And it really is. It's a 1 year later, you look in the mirror one day and you're like, whoa, there we are. We're here again. Like, we finally made it. We did it. And so it does take a long time to get there, but I know leading up to it, it was a lot of investigating and meeting with different doctors and, looking around, and then it'd take a 2 year break because you couldn't find someone. And so I think when I finally met you, it was, we booked the appointment right then and there, and I showed up 2 weeks later. So it was a very quick, like, yes, we're going to get it done. Sorry.
No, keep going. You're just telling your story.
Yeah. But
what did it feel like?
Afterwards, it was, I think, tough for a month as I was kind of getting back to normal looking. And I think it wasn't in my nose. My nose looked great right away. It was kind of my cheeks and stuff where it was, my whole face was kind of like setting back into its normal motion. And so then I'd say about a month out, I was like, yes, there's no swelling. I feel incredible. And then from that point on, I remember thinking it can't get any better. Like, this is where we're at. And it did. It slowly kept getting better and better and healing. And
so, okay, I want to ask you a super personal question.
Okay.
Okay. So in the last 2 years, you have probably made friends, gone out, done various social activities, right?
Yeah.
Okay. Do people know you've had a nose job?
I can't keep a secret.
Okay.
So do I tell people? Yeah, all the time. Do they know? No. And they constantly ask, can I see the before picture? Can I see the before? Well, what did you look like? And I'll show them, I'll say, look, and they're like, wow, oh my gosh, no one would have ever known. It is truly the most natural. No one's ever guessed it or seen it. And now it makes me question people sometimes that have perfect noses. I'm like, ooh, I wonder.
That's good. I never thought of it from that perspective. Yeah. So I met a really cool patient. This is a patient I operated in 2009. I did a rhinoplasty on her. She was like, I don't know, 21 or 22 years old at the time. Okay. Life goes on, life goes on. Okay, so we're like now, what, 17, 18, well, a lot longer later. She comes in with her husband, okay? And she had never told her husband she'd had rhinoplasty, okay?
It's iconic.
She's in the post-op book. He flips and he goes, oh my God, this is you!
That's incredible, oh my gosh.
Yeah.
I don't tell guys that I got it done. They'll never know.
Huh, interesting.
I mean, I would if someone asked, but that isn't something I'm bringing up on first dates or anything, but.
Cool, so no one knows, huh?
Yeah.
Interesting. Okay, so you have a very unique perspective at this point. I know you talked to one of my future patients. So you have a chance to speak to people. What would you say? Like you have, this is your, like I want to synopsize your story. So you thought about this for 10 years. You had your surgery. You've crossed all these Rubicons at this point. What would be your words of wisdom for them?
Do it now and not later. I think waiting is just putting off the inevitable. I'm very glad that I did it while I was in my youth because I'm getting to look my best while I'm at my peak in my best of life, if that makes sense. I think that at the end of the day, the only regrets I have is like not meeting you sooner and not coming at 21 instead of 25.
It was meant to be.
It was. One, from that point forward, it was, my nose isn't a concern. I'm not spending, an extra 15 minutes going like this, contouring and making it all perfect with makeup. It's just kind of a relief. You get to forget those makeup products and move forward. And I think, my best advice to anyone is to go ahead and do it if they want to do it. And also do it and then be happy. I think I have a lot of friends too that'll do it multiple times. And I think that I knew we were coming in, we were going to do it one time and done, and I'm so happy. And that's why I also, like I was telling your future patient, look at the photo, sure, look at the computerized photo, but once you get out and in real life, take those photos and let that be kind of your canvas of where you started and where you ended up, because ultimately a computer can only tell you so much. You cannot face tune a nose job on yourself as much as you try. Like, I think that's
and I suck as a Photoshop artist.
It's spot on. If I take the computerized photo of myself and a current photo of myself, it is exactly what it is.
Okay, so maybe I'm not that bad.
You're not that bad. But at the end of the day, you've got to look at your chin, and as your face develops, the way that you look a year out and 2 years out isn't, when you're fully healed,
right.
It isn't what you looked like on that day with that old nose.
So, this is just for, and every time we do one of these things, the people watching this, I think you guys get to hear about Melissa's experience and all this kinds of stuff, and it also gives me an opportunity because she said some very interesting things, and I get to drop an ounce of teaching in here. So when we do these computerized images, so there's a couple of caveats to this that I think that are really, really super important. First of all, I don't know what everybody else does. I don't bother myself with everybody, but I do my own computer imaging, okay? Now, there's a rationale for that because, number one, I know the anatomy. I know what your anatomy is, and I can give you realistic what it is. One. Two, the downside of that is the computer programs and all that, there's actually more advanced stuff on the Apple App Store than there really is for surgeons, which sounds really crazy, but the stuff that's available to filter your nose or filter your face with AI and all these things is actually more advanced than the stuff we have. One. And two, the other thing is that for me, you guys don't recognize how frustrating it is to draw a nose with a mouse. I can do it with a scalpel all day long, twice on Sunday, but give me this block of plastic and say, craft me a nose. It's one of the hardest things for me. It still to this day. Like your rhinoplasty to me technically was easier than doing your imaging.
I believe it.
Okay. And so I do the imaging for a couple of purposes. And the reasons we do imaging, I want to make sure that my overall aesthetic of what I like proportion wise matches your proportion of what you got in your head. That's the rationale. Like if you come in and you tell me, dude, I want this really tiny nose with a super scoop, like I need to be able to show you what that looks like so you can go, okay, yeah, maybe not.
Yeah.
You know, that's the rationale for it more than anything else.
That makes sense. One, I remember at first when I had come in, I remember me and you talked about my nostrils.
Because you wanted your nostrils.
I thought I wanted it smaller, and you said, okay, well, and you had showed me one of them is connected and one of them is a little disconnected, and I don't know if the camera can see that, but you said, okay, well, would you want them both to give the appearance of being disconnected? Because if I have to stitch it back on, then they would both look like that. And so it kind of opened my eyes, and I think that was something that the photos really showed me too, is, okay, no, that doesn't happen, but once this bump is gone, the appearance from the front is going to give you that kind of smaller, cuter look, because you're not going to have, you know, so much depth perception.
Right.
And so,
so
that helped a lot.
I hope all you guys really, I mean, first of all, thanks to Melissa here for truly being so open. I mean, you guys, like, I say this to everybody that's on these little videos, you guys really do not recognize the impact that you have on other people. At this point in the game, I mean, there's so many people that look at our YouTube channel and they go, there's that one girl, and they'll say something, I'm like, oh, you mean? And so the people are like, I had a patient the other day that I was operating on, okay, and she came in and she's goofed up in the operating room under like semi-anesthesia going, are you wearing your cowboy boots? And I'm like, she goes, I saw that you wear boots in the OR. And I'm like, wow. Like, this is what she's thinking about at this moment, you know? So people are watching and they're really like, so your stories mean so much because it allows other people to understand how, what, where, when, why, and be able to touch this thing, which is kind of a black box to most people. Like now for you, you've crossed it, you know what it is, but to everybody else it isn't. So first of all, thank you so much for being like, you know, hey, this is what it is. It really helps people. And if you guys have any questions, always, you know, drop a line in the comments, say hello, call me. I like talking to people. Melissa can attest to that. We like talking. And thanks for watching.
Bye, thanks.